doesn't do it. Affordable. And this is where healthy lower.
We have always believed that one of the things that holds this country back in terms of achieving a high level of population health is the fact that we have so many people who are uninsured. And that's been a major motivation for pushing forward on the Affordable Care Act. Well, we've actually had some evidence in the last couple of years about the role of health insurance in improving the health of the population. And the evidence, when you look at the surface, actually seems a little disappointing. And it's worth understanding what's going on. Kate Baker has done some very important work here at the Harvard School of Public Health, where she's been examining the role of giving people access to health insurance and the impact that has on their health. So she looked at Oregon, the state of Oregon, when they expanded Medicaid using a lottery. And she looked at people who got Medicaid, a public health insurance, versus people who remain uninsured. And what she found was that getting access to public health insurance reduced financial bankruptcy, as we would expect, but it didn't seem to have a big effect on the health of the population. People who got Medicaid didn't seem to be that much better off from a health point of view compared to people who remain uninsured. And this has been puzzling. And people have wondered why. How could giving people access to health insurance not have a big effect on their health? And that's because health insurance gives you more access to health care. But health care isn't health. And a major problem is that our healthcare delivery system often is unsafe, it can harm people, and it delivers care in an unreliable fashion. If you think about the big things that really cause morbidity and mortality and suffering, things like heart disease, high blood pressure, diabetes, chronic diseases, our system is just not very good at managing those things, whether you're insured or uninsured. It doesn't matter. Now, the Affordable Care Act does have some provisions to try to improve quality and safety, but they're really baby steps. They're really not enough. And the studies suggest that unless we also focus on quality, unless we also focus on making the healthcare system really responsive to the needs of the population, the efforts that we see within the ACA are not going to be enough to really improve the health of the American public.
Thank you for joining ACA this week.